of the Scrutiny Committee. I'm Councillor James Wright, Chair of the Scrutiny Committee, and I'll be chairing the meeting. To begin, a few matters of housekeeping. Action in the event of an emergency. There are no practice alarms planned for this meeting, so if an alarm sounds, please evacuate City Hall by going down the main staircase and out to the War Memorial in front of City Hall. Please would speakers use microphones at all times and speak directly into the microphone. Please mute the microphone when not speaking. The meeting is being live streamed on the Council's YouTube channel. So welcome to any viewers. Members of the committee may use electronic devices to access their meeting papers, and visitors are welcome to use mobile phones and other devices, including cameras, but please use them discreetly, set them to silent, and do not use voice or camera flash functions. Members of the committee and officers will introduce themselves, starting from my left and going around the room.
Councillor Lucy Galvin.
Councillor Richard Laws.
Councillor Charlie Kane.
Councillor Karen Davis.
Councillor Jenny Knight.
Councillor Sue Sands.
Councillor Mike Sands.
Councillor Chris Smith.
Councillor Ian Stuteley.
Emily Yule, Executive Director of Resources. Alexandra Cosmo, Senior Committee Officer.
Thank you very much. We have apologies. Councillor Hoekner sends her apologies, and Councillor Knight is the substitute. Welcome. And Councillor Champion sends his apologies, and Councillor Kane is substitute. Welcome. And we had apologies from Councillor Kendrick. Item 2, declarations of interest. Any declarations? Councillor Laws.
Just precautionary, I think, but there are references in the minutes and monetary places to the private rented sector and PBSA. So just a general declaration of my interest as a student landlord. I don't think there's anything coming up to discuss or certainly vote on today, but and it's all on my register of interest anyway, but just for
great. Thank you very much.
Caution.
Thank you. Any others? No. So the minutes of the meeting held on 17th of July are before you for confirmation. Are there any points of accuracy that need to be raised? No. I'll propose those. Could I have a seconder, please? Councillor Davis. All those in agreement, please indicate. Thank you very much. They are carried. Now, the next item should be HR processes. I'm going to use my discretion to reorder the agenda simply because I think that Councillor Fulton McAllister will be interested in the HR processes item, and I gather he's running a few minutes late. So we'll move over to item 5, which is the report from the Norfolk Health Overview and Scrutiny Committee. Councillor Galvin, over to you, please.
Thank you very much. There are 2 meetings I'll cover. So there's one in July and one in September. And I'll just give you a quick edited highlights, but we'll send through the links to the actual minutes if you want to look a bit deeper into them. We had the committee's got a new name now. It's called the Health Overview Select Committee, but that handily is still HOSC as an acronym, and the functions stay the same. And the new chair of it, well, the same chair was re-elected, Brenda Jones, and Pallavi Devulapalli is elected vice chair again. So the same. We looked at 3 things in July: the Norfolk and Waveney Integrated Care Board transition. So you haven't got any papers on this, just a verbal update. So you will get this. Yeah, I didn't submit them so that Alex could send them out, but I've just written them up and we'll send them out. So item 6 we looked at in July was the Integrated Care Board transition, the ICB, which is the abolishment of NHS England, you remember, and the reduction in ICB's operational running costs. So the 6 regional ICBs are going to be consolidated into 3, and Norfolk and Suffolk are going to merge, and there's a 50% staff reduction across Norfolk and Suffolk. I think you've probably heard about that. It's quite interesting to hear it again, I think, from a HOSC perspective. They were there to explain to us, the ICB, what that feels like, and it's obviously horrific for them. It's hard work, but it is going forward. We also had the announcement that Health Watch is going to be abolished nationally at that meeting. And the removal of integrated care partnerships was also discussed. So Health Watch, I don't know if everyone here knows Health Watch, but since 2012, they've provided an impartial, trusted forum for patients and service users to share their experiences of health and social care. They've done reports. It's acted as a critical friend to NHS providers. It's a national setup, but there's a local one for Norfolk, and it's helped Norfolk's residents to be heard and be acted upon in health terms. So it's really disappointing that their government has abolished Health Watch as a national thing. It's going to take a couple of years to get rid of it. But in the last financial year alone, Health Watch Norfolk has gathered over 5,299 pieces of feedback from patients and provided direct support to 200 individuals and published 40 reports on key aspects of health and social care. And so they're not, as they say on their website, it's not really just numbers, and they are actual lives improved, and it's a really important organisation. There isn't another thing like that for representing patients and shining a light. So there is a petition to save Health Watch on their website, which is worth having a look at and sharing, I think. It's the only independent voice locally, and HOSC as a committee, we decided to write to the Secretary of State, and so we did. And we haven't had a response yet. That was in July. We wrote in August. We're hoping for a response by the 18th. Oh, actually by now. So I've asked for an update, but I don't think we've had one. I don't know if as a committee we wanted to do anything about that ourselves, about Health Watch, or ask for anything to come. It might be something to consider. I'm the link member for Norfolk Community Health and Care NHS Trust for the committee, and Councillor Neil, who's a county councillor, is for the NNN. If you need any councillor to be a link member through to those two local hospital services. That brings me on to the 4th of September meeting, and if there's any questions on any of that one. So on the 4th of September, we had 2 items and the work programme. So the first item was an update on the Norfolk and Waveney University Hospitals Group. I don't know if you know about that. That's the big university hospitals of Norfolk are joining together at a very top level to have an executive function. They're all staying their own legal entity, but there'll be a substantive chair of the group in October 2025 made. They gave us a very frank report about the issues affecting patient care and the waiting times and the financial environment they're operating in. And it was acknowledged that all of those 3 big trusts are currently in financial recovery programmes, and they're all in the bottom quarter, we heard nationally, and indeed Queen Elizabeth at King's Lynn is the bottom hospital in the whole country. So really disappointing and concerning, and good to hear that they're aware and we're honest about it, trying to do something about it. We're going to look into digital transformation and electronic paper records in March, at the March meeting, and we've got all member briefings on updates to new hospitals programme, and we're looking into feedback on the transport system in Norfolk, if you're interested in talking to me about that as part of a broader conversation between local authorities and transport companies around provision of hospital transport, because it's obviously something that's quite problematic. And then item 6 was nearly there, that this is the advice and guidance model. I think this is all quite interesting. Their government is really upping the amount of advice and guidance, it's called, where a GP seeks further advice from a specialist at a hospital. You may have had that when you've gone to your GP, and it's called advice and guidance, and it's a way of stopping you ending up in hospital, basically, or in the hospital system, because they get some early advice. So it was always informal, but now it's a formal mechanism for primary care, which is a GP care to access the specialist advice at the hospital. It's always been a pathway since 2015, but hasn't had specific funding till now, and the funding is allocated now to acknowledge the work involved and about 30,000 advice and guidance requests per year in Norfolk and Waveney, but they want there to be more. So they want to get it up to 77,000 because basically they want GPs to be able to access advice so you won't go into the hospital system. So it was very interesting to discuss. And we queried what safeguards were in place to ensure diagnosis or appropriate treatment wasn't missed. And that they did tell us they've set up a task force. So we've asked them to come back in 9 months' time to scrutinise the effectiveness of that system. We've also asked for a report on weekend pathology services and a future report on the Wellness on Wheels bus, which you might have seen in the city. So it's interesting things. If you have any health things that you think really should be looked at from the city's point of view, it's worth bringing them to me as the rep, and then I can take them to HOSC and try and get them on the work programme. Lastly, on that work programme, it was noted that a report on the homeless surgery, this is very specific to Norwich, there's a homeless surgery in health inclusion services, was on the work programme. It's still on the work programme for HOSC, but the ICB is currently reletting the contract for the homeless surgery in Norwich, as well as the walk-in centre. You'll remember the homeless surgery is also known as the Vulnerable Adult Service. On Westwick Street, you might know it. It's a specialist surgery with over 100 patients on its books, and it works closely with other services and has done so for over 2 decades. It provides expert care for the most vulnerable, including homeless, sex workers, those who have recently left prison, drug users and others. And it had been under threat earlier this year in the consultation, which you remember, but that was abandoned as it was not fit for purpose. And the ICB then said that there would be no change to the service. I want to check they haven't gone back on this, as if changes are made, it could be detrimental to the safety of the service going forward, detrimental to the health of the most vulnerable, and detrimental to the rest of the health service in Norwich and further afield, as people who need specialist care will be thrown back into the mainstream service, which is not equipped to treat them, which will be more costly and not effective. For example, if a doctor's registered service, if it's not part of the service going forward, patients won't have their own GP at the clinic. And they'd no longer get an effective service and could end up calling ambulances, going to hospital, remaining untreated and quite possibly dying as a result. And the service was set up precisely so people had their own doctors, because mainstream GPs in practices in Norwich wanted it. So it was 20 years ago, because they couldn't cope with treating those very complex, the system couldn't cope with treating very complex patients who have multiple health needs within mainstream settings. At present, the service provides outreach and support service, and I visited it on behalf of this scrutiny committee earlier in the year, and spoke to patients, support workers and medics. It was notably a good service and follows best practice. And one of the patients told me, without this service, people would die. So the select committee the HOSC has not had sight of the specification, the new service specification. So it was asked in the meeting on the 4th of September if there were any changes to that service. And the medical director of the ICB answered that there had been no changes, but then said she was not sure, so would give a written answer. The answer was provided 6 working days later, which was last Friday, after some reminders, and marked as confidential. And I've challenged that confidentiality ruling with the monitoring officer at county, because I don't think it's in the public interest. So I'd like to ask this committee to consider writing a recommendation to the HOSC at county to ask them to scrutinise the specification openly, because of the health impacts it will have on this city if there are substantial changes. So I wanted to put that in front of us today.
Yeah, thank you very much, and I'd be happy to second that request. A recommendation from us to request them to do that. Do any members have any questions of Councillor Galvin? Councillor Davis.
Thank you. So on the new service specifications, that document has been provided to HOSC as confidential.
That's correct, yes. It has. Last Friday it was circulated, but marked confidential.
And did they give a reason for it being marked as confidential?
No, I've inquired, but haven't had an answer.
Any other questions? Well, let's pop to the vote then, asking Hos to look into that. All those in favour? That is carried unanimously. So thank you very much, and thank you for your very comprehensive report, Councillor Galvin. That is incredibly useful, and hopefully there will be some light that can be shone on that process as a result of this. So thank you. Right, so that's item 5. Councillor Fulton McAllister, you'll be pleased to know that we're now going to circle back round to item 4, which I thought might be something of interest to you. So we rejigged the agenda a little bit. No problem. So we're now moving on to item 4, which is HR processes, and I'll hand over to Emily Yule to walk us through that. Thank you, Emily.
Thank you, Chair. Good evening, committee members. I'm pleased to present this report to the Scrutiny Committee, which covers items raised in the scoping document for this topic, as well as drawing pertinent points from the corporate peer review in 2023 and the more recent review of the HR service. We are acutely aware that there is significant scope for improvement in both the efficiency of the current service and its readiness to meet future needs of and challenges facing the organisation, particularly in the context of our readiness for local government reorganisation. The improvement work is already in progress via the action plan that's been developed, and that action plan is currently being further enhanced by the team. I'm very happy to share that document with the committee, but because it hadn't been through the process of engagement with the staff, with the team itself, I didn't want to bring that at this stage. So once we've got it into a finalised version, I'm happy to share that with the committee. I won't go into a lot of detail about the content of the report, but committee members will note that improvements have already been made in some areas, so notably the reduction in our spend on interim and agency staff, and also improvements in respect of the DBS audit that has gone through the audit committee. So progress already made in those areas, but there are a number of themes where further work is still needed. I'm very happy to take any questions, Chair, and welcome the committee's recommendations, which may be directed to the head of paid service or to the Cabinet as appropriate.
Thank you. Thank you very much. Over to members for questions on that. Councillor Davis and then Councillor Kane.
I've got lots of questions. Shall we start at the beginning of the report and then just take it in turns to ask questions as we go through? Yeah. Okay. So right. So the first bit I want to ask. So page 18, para 4.10. It's about the average number of applications per role. I wondered what the breakdown was for applications at different grade levels within that, and at what level does that start tailing off? Because the average, the highest number of 98 for customer contact is a lot, but then at what level does it start to tail off?
So I think it's a more complex picture than that, and it's not linked necessarily to the scale of the job within the organisational structure. So quite often it can be linked to how generic a job description is and whether that hits a lot of skills that a wide range of people would have. And obviously something like the trainee digital developer role is quite a niche area, so that's where we see lesser applications. So I wouldn't say the volume of applications is linked or tapers off at certain points in the organisation. I think it just very much depends on the role. Obviously today I haven't got the detail of kind of what that looks like for lots of different individual roles, but we could give you a more enhanced flavour of that if that's helpful.
Yeah, thanks. That'll be interesting. It'd just be interesting to see what kind of roles are being gone for and what kind of educational level or grade the most people are feeling confident to apply for.
And actually there's an interesting sort of secondary aspect, I think, to the example given in the report here, that when you're looking at things, particularly around digital, the public sector, I think, has a real challenge to keep up with the private sector in terms of what the remuneration looks like for that. I think that must present a real challenge for us. Not that I can say that word, we've been trying to say that many times today, but yeah, I don't know if, Emily, that's sort of something you sort of back up.
Yes, absolutely. I think there's a number of areas within the council's business where we're not competitive in terms of salary with the private sector. And, you know, people don't always apply for jobs just on the basis of the salary package. There's a whole load of other benefits that come with working for a local authority and working particularly for Norwich City Council. So, yeah, I think it's not always the only driving factor, but there are some areas where we just can't compete. And some of that is the professional sectors, so lawyers, planners, things like that. And some of that is the emerging kind of work areas. So in the digital space, absolutely.
Give that, Councillor Kane.
Thank you, Chair. Like Councillor Davis, I've got a few questions, so I will just start at the beginning, and maybe some other people will also pick up on some of the stuff I did. I'm just looking at the first page where there's a bit about diversity, and I'm aware that there is a separate equality. Sorry, I am aware that there's a separate equalities report. But considering we've gone into diversity in this paragraph, I wonder whether there is going to be, or could we have a separate report on diversity and the steps taken to improve representation of diversity in the city, of the city population amongst the council's workforce? And also, because it's connected to that, do we already have stats on this to let us know how well we're doing?
Yeah, so you're absolutely right. We do have the separate equalities monitoring report that comes through on an annual basis. And we can absolutely, if that's a topic that the Scrutiny Committee would like to deep dive into in terms of diversity within our workforce, we could absolutely produce a more detailed report on that. What this report does acknowledge is that we know that there is a kind of low level of disclosure, particularly of protected characteristics. So we know that not all employees are filling in their monitoring data, and we're trying to understand what's motivating that lack of disclosure. But absolutely, we could bring a kind of more detailed report on that, particularly, I think, looking at some of those cases where there are multiple characteristics at play.
Thank you very much. Councillor Davies, and then Councillor Fulton McAllister.
Thank you. So on page 19, on the exit interviews, so completion rate of 26% in Q1 this year. Do we have stats for a longer period, like over the last 3 years? What's the percentage rate? Has that gone up or down? And it does seem very low. So it says work is being done to embed exit interviews into the lever processes, but I'd like to know how long this would take. And it says this may not provide a representative view of employee sentiment. I don't know what that means. Is that in terms of feedback you're receiving from the exit interviews? And I'd like to know if people are feeling mentally strong enough to attend an exit interview, because it might be quite difficult for a lot of people to attend, and what's being put in place to help them to actually attend those exit interviews and feedback.
So in terms of the previous statistics, one of the challenges in preparing this report is a lack of consistency in data gathering over past years. So I'm really conscious of not bringing in stats that don't provide a kind of fair comparison in terms of them measuring in the same way. But I can go back and see if there are some legacy stats that I could offer you in terms of history around exit interviews. The work about encouraging take up of exit interviews is already happening, so that is already in place, and we offer a range of different ways that an employee can participate in that exit interview. So there's a paper questionnaire. There's also the opportunity to have a conversation with your line manager. There's also the opportunity to have an exit interview with someone who's not your line manager, because let's face it, your line manager might be the reason that you're leaving. I've also engaged with our union colleagues ahead of bringing this report, and they have fed back to me that anecdotally there does seem to be a reluctance to sometimes participate in exit interviews, because perhaps the employees don't always know or don't always trust how that information is going to be used or dealt with. So I want to kind of dig into that with the unions and really make sure that we can develop a culture of openness and where people feel confident. And absolutely, if somebody is leaving who is experiencing poor mental health or has had a bad experience, that we support them to complete the exit interview either right then or perhaps in a few months' time when they feel able to fill it in. In terms of the point around may not be a representative view, I think that's just to acknowledge that because we've got such a low take up, the information that we've got from exit interviews at the moment isn't kind of representative, and also people have different motivations for leaving and what they might say in exit interviews. So I think we have to kind of really look at that with an analytical eye when we do get that information back.
It mentions a bit later, this kind of relates back to what I was saying about people's mental health, which probably isn't going to be in a great place if they've just left their job. So it says that there's a staff mental health working group. When was the last time that was facilitated?
So the honest answer to that is I don't know the last time that the mental health and wellbeing group met. But it's something that we want to reinvigorate, because I do know that a number of meetings have been cancelled due to availability of people to attend and such like. So it's something that needs to be refreshed. And you'll also see, I think it refers to it in the report, that we're currently trying to recruit additional mental health first aiders so that we do have a bigger kind of pool of people that can participate in that wellbeing group.
Thank you. Councillor Fulton McAllister.
Cool, thank you, Chair. So unfortunately, there are a few questions I may have. I want to start by saying actually there are some really positive things like reducing the agency spend, because even if we extrapolate that, actually that's looking at about 2.3 million rather than the worryingly high 5.19 million. So that's a really good trajectory. Obviously, I think most people know around this table know my views on how our HR services have been managed in the past. So I won't go into that. I'd like to pick up first of all on cultural change and staff engagement. I think that what is here is really positive, moving in the right direction, where line managers are empowered to undertake the HR decisions within their departments. That's how it should be. But with that comes a huge training need. And you do acknowledge that there's a significant training need. What I'd like to suggest is that that training, as I know has been done in the past, is delivered through ACAS specifically, because ultimately, ACAS are the government endorsed and funded organisation, and I think that you can get some pretty dodgy HR practices out of there from organisations beginning with a P, frankly. Those who have any background in HR will know who I'm referring to. In terms of the consultation that's gone on into this review with the trade union movement, so that was point one. It's not really a question, but if it could be taken on board, that would be great. Consultation with trade unions. Ultimately, the JNCC structure is up and running. It would be good to know how they are going to be included in the cultural change that you want to see, because there is an acknowledgement they should be included, but some flesh on the bones around that would be really helpful. In terms of the exit interviews, I think was the next section. Exit interviews are notoriously unreliable because there is still a power imbalance between an employer and even an ex-employer and an ex-employee, because that person is relying on the organisation for their reference into their next job. Local government, like lots of industries, is a small sector when you know people. Ideally, I'd like to see some mechanism where perhaps it could be a mechanism could be worked up with the trade unions to establish an anonymized form that can be completed. Obviously, if it's accessed, the moment someone leaves, you know who's said it. But if it's only accessed once a year and you have a joint mechanism with the trade unions and HR where ultimately it requires 2 codes to be input and you access it once a year and you see what your exit interviews said, actually you'd have a little more faith in the results telling the true picture. I would suspect from that half of those people who are not completing it had something negative to say, and the other 25% essentially couldn't be bothered to complete the exit interview. I've made my comments on agency spend, which was incredibly positive. Recruitment panels, I think with the cultural change aspect that the employer is trying to, that the council is going into trade union mode there, that the council is trying to achieve, actually I think this would be a really good point to consider things like 360 interviews, where you have somebody who is going to be working below the person, if it's a managerial role, for example, being on that interview panel. It could be done through a lottery, through a rota-based system. It could be done through colleague elections, however the council saw fit. I think probably a lottery would be the easiest type of way of doing this. But that way you ensure that you've got managers who can actually work with the people they're going to be managing. So that's brought us up to about 5.4. Sorry, did you want me just to throw questions at you and then answer all of them?
We probably should have a pause and get some answers in.
Sorry.
Thank you, Chair. I was hoping there might be a pause just so I could trot through some of those points. So absolutely agree with utilising ACAS, and certainly our HR team have already done some ACAS-led training, but we could certainly look at that in terms of the upskilling of managers. You mentioned about unions being included in cultural change. Absolutely, we really want to work alongside our union colleagues on this, and I think from my perspective, we've seen a dramatic change in the emphasis in JCNC around the types of conversations we're having, and they're very much more about co-designing and collaborating and coming up with solutions together, rather than it perhaps being, employer side offering a solution and asking for feedback and then may or may not take on that feedback. So it's much more in that kind of collaboration and co-design space. The exit interviews, yeah, we could look at an anonymised form. I'd have to offer a bit of challenge back and say, our primary focus here should be on creating an environment where people do feel safe to give feedback in one of those quality exit interviews. So having the chance to have a conversation, being able to talk through the issues, and that's what I aspire to for our organisation, is we have that culture of trust, openness and psychological safety, so you can share that feedback. But I also accept that there will still be some people who find that prohibitive, and so we could look at a kind of anonymised process for that. And the other thing I want to say about that is, of course, it's also really important that we talk to our existing employees and we gather feedback and kind of take what we call pulse surveys from our from our people who are actually still working here. So we're also going to look at how we could kind of roll that out to the organisation over the next well, on an ongoing basis, but probably kind of a quarterly type pulse survey that just measures various indicators for how the organisation is feeling. 360 interviews, yes, absolutely, agree with that. And actually for our senior recruitment, we do utilise employee panels and stakeholder panels, so we get a wider perspective when we're making those recruitment decisions. Thank you, Chair.
Great, thank you.
Did you want to let other people have a go?
Oh yes, I'll just
finish.
You'll be fine. I'll bring in Councillor Galvin, who is next. Note some other hands, and then bring you back for round 2 in a minute.
Thank you.
Yeah, thank you. Councillor Galvin, then Councillor Knight.
Thank you, and thank you for the report. It's a very wide-ranging report, and I just wanted to step back a minute and sort of ask about the context of it. There's ever such a lot in it, and I feel that it's a bit of a tip of an iceberg one, I think, and that we might want to try and think about different bits we can unpack going forward. And because it's to be honest, it's quite a shocking report in some ways, in that it's obviously opening up something that hasn't been opened up for a long time. So my real question is, how did things get so bad? I don't know if you've got insights on that you want to share. Have we had a complete change of team there? Like, how are we going to operationalise this change? So we need to sort of unpack it, the different elements of it, and then know going forward what the action plan is to make this change, because I think we need to recognise that there's a big change needed out of this report. So I'm just interested if because it's worrying when you see that as councillors, something that we have been aware of and we have raised, some of us a few times. It's good to see it here, but now how do we go forward?
So I think there are a mixture of factors that have impacted where the service has got to. Some of that is around a lack of modernisation. So some of this is about not kind of moving with modern employment practices or responding to a changing need of our workforce. Some of this is around not having the right resources in the right places. So, for example, we know that learning and development and OD has been under-resourced within the HR team, and there's been a focus on kind of the employee relations type stuff instead of perhaps some of that wider kind of more holistic parts of the HR service. And I think probably there's an opportunity to bring some sort of fresh thinking into this space, particularly into the leadership of the HR service, and to really kind of do that piece around creating an HR service that is suitable not just to support the managers in their role, but also to support the workforce, because I don't think that balance has always been quite right. So I think there's a number of things at play that have led to us recognising that there's been a kind of underperformance, albeit I would say that when we get into the space of kind of compliance and dealing with employee disputes, we've typically performed quite well in that space. So it's not kind of making the council vulnerable to challenge, but it's a recognition that it could work a lot better.
Just follow up. So really, I think the committee today will probably raise up lots of different points of interest around it, but we need to make sure that we trap all of those into some sort of work programme and come back on this, because it feels like the beginning of something. But,
Lou.
Thank you, Chair, and thank you, Councillor Galvin. And I think just to add well, just perhaps provide a bit more context to what Emily said. I mean, Emily started with this just over a year ago, 18 months ago, and part of those discussions were that we had a need to modernise our people services, and Emily's taken that forward. We've undertaken the review, and that has identified, you know, the kind of the position of the service and given us some pointers for what we need to do going forward. There's an action plan in development, and Emily's mentioned that can be shared with the committee as soon as we've got it to a place that's kind of fit to bring to you. It's almost there, isn't it? So that can be shared, and then I think that might also help with what you're suggesting about packing it and seeing where those areas of focus are going to be, having a look at it, seeing if that kind of aligns with where your views are, and we can then perhaps build something out of that.
Thank you. Councillor Knight is next, please.
Thank you, Chair. First of all, I just want to echo Councillor Fulton McAllister's point about how well we've got done in lowering agency spend, but I'm quite interested in what is the average agency spend for similar sized councils and how we compare, just so that we can try and understand how to prevent this from happening again. How's our agency staff being chosen by the vacancy management panel? What's that process? Are we headhunting? If so, what are the costs of that? And also, can we get a split up statistics for interim versus agency staff on the spend rather than combining them together? Thank you.
Thank you.
Thank you. There are a number of really important points in there. I do not have benchmarking data on interim and agency spend, partly because lots of organisations describe it in different ways, and so it's not always easy to get a like-for-like comparison in terms of that benchmark, but we can go away and see if there's something out there that we can, even if it's, you know, ringing up a council that we know is similar to us in size, and trying to get some comparisons in that way. In terms of the vacancy management panel, we don't actually approve the appointments. The process is that the recruiting manager comes to submits to vacancy management panel, suggests they want to fill a vacancy, and then we confirm the recruitment method. So if a recruiting manager comes to us and says, we want to fill this via an agency worker, we would have a look at that and ask questions like, well, why can't it be filled on a permanent basis? Why is agency most appropriate in this circumstance? Even questions like, do we really need to fill this post at this time? Have you really thought about, could there be a revision to the job scope and that kind of stuff? So it's a kind of, it's a challenge, it's a check and challenge session, if you like, to make sure that vacancies are being filled in the most appropriate way. And then in terms of the categorisation of different types of interim or agency staff, that's something we are working on, because what we would like to be able to do is be able to explain to the council, to councillors, to say, you know, these are true interims, they're specialist additional capacity that we've brought in for a fixed period of time, perhaps for a particular project or a particular area of expertise. These are agency staff that are used as a bank, so for high churn areas or where we know we have peaks and troughs in workload. So we're trying to do that piece of work. I would say it's a bit hit and miss at the moment, because some of the categorisation hasn't always been that spot on, but we're working on that.
Okay, thank you. So just for members' benefit, I will run through the list of names of people I've noted down as having indicated. Councillors Kane, Davies, Fulton McAllister, Laws, Mike Sands and Smith. In which case, Councillor Kane, you're next, please.
Thank you, Chair. So I just had a few quick questions on page 21 and the mental health related stuff and absence and stuff. One of these questions you might have sort of already answered, because you spoke to Councillor Davis about data not being collated well in the past. But just looking at this reduction in mental health related absence, that is an incredible reduction, by the way, 26.4%. But it says year on year, and we've got 23 to 24 and 24 to 25. I just wondered whether the absence of the earlier years was because of that, or whether there is any indication that that is an ongoing trend, or that it's just for those years that we've got in the report. Sorry, just a couple more. I wondered whether we knew what the reduction was down to. If there's been any sort of staff survey on mental health or anything like that, and whether this is on permanent staff numbers. And just one other thing, it's not mentioned in the report that I've seen, but I wonder if anything has been done or could be done about looking into how staff are getting on with accessing the free counselling sessions. I certainly know on a personal level that, number one, needing those sessions often comes at a crisis point, and so it needs to be timely, but also two, it was incredibly difficult to do, and on a personal level, in the end, for me, I gave up. And I'd hate to see that repeated for other people, so I'd just like to flag that up and ask that that could be looked into.
Yeah, so in terms of the statistics, that reduction is simply based on the 2 years that are presented in the report. Again, because of some of the inconsistencies in data collation in the past, we'd need to do a bit more number crunching before I feel confident about presenting figures to yourselves. I don't know that we have understood fully what are the causes of that reduction, and of course this is a factor that's influenced by many different things, because this relates to personal stress, anxiety and depression, as well as work-related stress, anxiety and depression. So there's so many different factors that could be driving how people are feeling and whether they're absent from work due to those mental health related issues. But it is something that we as a leadership team do pay close attention to, and I think that's probably something that we want to drive out a bit more, particularly as we start to evaluate the effectiveness of our interventions and the mental health kind of support mechanisms that we have in place. I absolutely agree with you that the employee assistance program facility needs to be as easy to access as possible, because you're absolutely right. You know, if you're accessing that, you may be in crisis or most likely be in a pretty bad place. I don't think, well, we don't have a formal way of collecting feedback from employees about how they've found the system. So that's something that we ought to look into. However, what I can say is I've witnessed firsthand the effectiveness of our mental health first aiders, and seen a member of staff who's needed that support, and within the space of 15 minutes had a trained person in a room with them providing that support and helping that person. So I think there's a range of factors that we see anecdotally working really well. I think it's about how we could get a bit more concrete information on the efficacy of those.
Yeah, just a quick follow up, if that's okay. Yeah, just to sort of reiterate that, what you were telling me about the first aiders, that's really fantastic. I think it goes on with the counselling stuff as well. It's so important that, everyone is aware right from the start. This is what you can do if you're in crisis. This is what you can do if you really need it, because I wasn't aware that was available, and it would have been really helpful to be aware of it. So I think it's just about making sure that everyone is really, really aware of everything from an early stage. Thanks.
Great. Thank you. Councillor Davis next, please.
Thank you. Just a quick follow up on Charlie's question. Do we know what percentage of the people, it says reduced by 26.4% year on year, do we know what percentage of those people are still here, or what percentage have left due to mental health?
No, I don't know that, but that doesn't mean we couldn't get that out of the system.
Yeah, that'd be really useful to see, if they had left due to that, that issue. I've got a question about the agency spend. So I'd like to know what percentage of kind of senior level interims have come through an agency, and what percentage are self-employed, I guess, and how those senior level interims are employed. Because previously, when we've we've employed senior level interims, they have come to a panel, councillors panel. But some of the recent ones, I don't think have come to a councillors interview panel. So I'd just like to know what the procedure was for their employment.
So there are a number of different ways that we would engage people who might fall into that interim and agency category, which, as we've recognised, is kind of a bit merged together at the moment. So there might be a case where there's sort of self-employed consultants who we appoint on a supplier and contractor basis. So that's through essentially a procurement process, and we would contract with them for a number of days. There are other senior interims that have been employed through an agency route, and depending on the nature and scale of their job and the length of time, that would dictate which employment process we use and whether that needs a member panel or not. And then we've also got directly employed staff at a senior level, but we would call those temporary staff opposed to interims or fixed term contract, because they're directly employed by the council and they have been through a member panel process.
So it's only the fixed term temporary interims staff that go through the member panel process.
It's those that are directly employed by the council opposed to being a commissioned service through an agency or through a consultant.
Thank you for that. Councillor Fulton McAllister next, please. And I've seen Councillor Susan's indicate.
Thank you. I'm back. So we were on 5.4. I'm going to try to get through the rest, which is very short, actually. So 5.5, good to see that we're likely to allocate additional resources to the HR team. What I'd like to put forward as a recommendation is that we also increase the amount of trade union facility time on a temporary only basis. Obviously, it will need to be temporary anyway, because it will be a new council who will make a decision on that, because there'll be a lot of work on the trade union side if we're working in partnership on this. 6.1 is fine. Sickness absence. The only comment there is it's a little difficult to tell if that reduction is because of a reduction in staff numbers, or if the reduction is a reduction of average days. You may well have that figure if there is a reduction in average days. I suspect there is, but if you would be able to confirm the rough reduction on average per person, that would be really helpful. And similar with regard to mental health related absence, because if that is a reduction, then that's really positive to see. I've got no comments on the wellbeing measures, which is great. Safeguarding and DBS checks. While it's disappointing that we have ended up in the position we are in there, it's good to see that there is progress being made to change that around. And I don't think I need to comment too much there. Ultimately, I think that the only other thing I'd like to raise, which isn't in the report, is, and I'm not going to discuss any details of individual cases, but I'd just like to ask that managers are given training, because it's been raised to me by full-time officials of different unions about issues of trade union reps undertaking their trade union duties. I'm just going to leave it there because I don't want to give any identifying information in a public forum, but it's really important to note the case law of UCL versus Brown, which obviously happy to discuss at a later point, and the ACAS code obviously stating that if any action is taken against any trade union office holder, then the regional union or HQ of that union needs to be informed, which is something that's been raised to me in discussion with my full-time official trade union colleagues. Thank you.
So just to come back on a couple of those points, and I think Louise might come in on the trade union time. In terms of the full-time equivalent figures, they're not in the report because I couldn't get them for the previous years, but I will continue to work on that because that does give a much better comparison, because it obviously it shows you the figure in relation to the size of the organisation. And with regards to trade union reps and having time to undertake their duties, just to reassure committee that all trade union reps have a list of agreed and authorised duties that have been agreed with regional, and their managers know exactly which things have to be done in their own time and which things are paid time off. So hopefully that reassures you that we've got those provisions in place.
In terms of Councillor Fulton McAllister's suggested recommendation for increasing the amount of facility time, presumably there's no direct budgetary impact because we're effectively looking at an opportunity cost of them spending less time on the other work that they do and increasing the proportion of trade union time. So I'm wondering, would that be a recommendation from this committee to Cabinet? Anyway, even though there's no sort of direct, I mean, it's a recommendation anyway, but it doesn't need to go sort of via a budget process. Anyway, so I'm sort of thinking aloud on that one.
Thank you, Chair. Yeah, and thanks. Emily's aware that yesterday I had a conversation with union colleagues about exactly that point. Councillor Fulton McAllister. So we've had a series of all staff briefings this week, which have been excellent. We've had something like 300 people roughly at those briefings this week, and we've been talking about LGR and other matters. I had a conversation following the end of the briefing yesterday with union colleagues, and we've agreed that we're going to have some conversations about how we take forward some of the work around local government reorganisation and staff support and, you know, change programme work, and we kind of do that collaboratively and build some of that together. And they of course flagged with me that that might well mean an increase in facility time. So we're going to pick a first conversation up at JCNC next week. We've got a planned meeting and we'll pick it up as any other business just to get it kind of logged. And then we're going to have some separate conversations about what that programme of work might look like and how, you know, we do that together. So already thinking about it.
Recommendation already sort of underway then, that's good. So seeing you, Councillor Knight. Councillor Laws is next, please.
Thank you very much. Thanks for the report. I see it's labelled HR processes, obviously goes a bit beyond processes, and obviously rightly so. It's just a slightly stepping back, a different kind of question. I just wondered to what extent membership of the relevant professional body, the CIPD, is either encouraged or required, not just for the sake of having another piece of paper or taking an academic interest in the subject, but that it may inculcate a sort of sense of professional identity, professionalism, and also know from personal experience that actually those who do it go through the process of acquiring the qualification, meet other professionals in that area and compare notes and develop networks, which can be helpful. So I just wondered what the council's view on that was.
Yeah, so we're very supportive of our employees being members of relevant professional bodies, and each role description, person spec will have identified any required professional memberships. So we do support that through contributions to professional membership fees. I also know that many of our employees hold qualifications that are outside of their kind of professional lane, if you like, and also kind of maintain professional development outside of their the requirements of their job role. So I'm really keen to understand how we can utilise that wider range of skills across the organisation, particularly through kind of cross-cutting project work.
Thanks. Yeah, that would apply specifically to people in the HR department. I was thinking particularly of the HR professional qualification, CIPD.
So there's a number of posts in HR that have a requirement for CIPD, and we've also got a number of colleagues in the team that are doing professional development at the moment to achieve qualifications in HR, and HR strands of HR in particular.
I was going to have a quick follow-up on Councillor Lawes' question. Many of the professional bodies are recognised by HMRC as a sort of legitimate for being collected through payroll, so that there's a tax saving for staff members. Is that something that we would do at the moment?
I'll have to take that away for somebody who knows more about deductions, payroll deductions and employee benefits and that kind of thing.
Just wondering if that is the case, then that might encourage membership of those professional bodies. Councillor Mike Sands, you're next, please.
Thank you, Chair. Just returning to recruitment and retention for a couple of minutes, if I may. I can understand why some vacancies are left vacant or put over to agency staff. As a couple of examples, County some time back had a shortfall of about 50 social workers and took to advertising on the trains to and from London and Norwich to fill those, and our own external auditors, KPMG, were unable to audit us properly because of a worldwide shortage of suitable auditors. So when it comes to attracting suitable applicants, what is the experience of Norwich City Council, and has it perhaps been best to train and promote from within and then employ someone more junior? And of course, having invested in these people, what do we perhaps do to retain them, stop them from being headhunted?
So I think there's a whole host of different kind of facets in that question. In terms of succession planning, career development, career progression pathways, and developing people within, we would absolutely look for opportunities where we could promote from within and where we could use our existing people and then kind of bring those on into high level roles, but obviously that's not always the possibility. So part of the questions that the vacancy management panel ask is this an internal only advert? Is it an internal and external? Is there a different way to fill this? And something that this council is very successful at utilising is secondments. So we do use secondments to enable people to stretch into different areas of the business, into different roles, and to have a chance at developing skills in those areas. In terms of the kind of retention of staff, obviously we try to make this a place that people want to keep working at and that want to stay at, and so there's a range of different things that we offer to our employees. So flexible working availability, the holiday entitlement, the access to the employee support programs. We're trying to develop our offer of employee networks, so there's more of that sense of community amongst staff members. So that's the kind of whole package. But ultimately, those people who have had training or professional development that's been funded by the council are required to sign a training agreement, which means they have to pay back that money if they do leave within so many years of receiving the training. But I wouldn't want to say that we try to incentivize people to stay by putting a financial burden on them. It's more about recovering our money if we put significant investment into somebody's training.
Thank you very much. Councillor Smith, please.
Thank you, Chair. Councillor Sands actually asked most of what I was going to ask about retention, so thank you for that, Emily. Mostly answered it, but if we just stay on retention a bit longer, do you have any kind of ballpark figures about what our retention rates of staff are in terms of average length of service, and does that compare favourably to other similar authorities? Are we keeping people on for longer than we'd expect, or less, or whatever? And just in maybe think about on the page 23, we've got the table of risk management, and we've identified recruitment as a risk, and obviously most of the report talks about it being a risk and the problems with recruiting we've all talked about. Is retention isn't there, so is retention not a risk? Is it something we're not concerned with, or Was it just something that wasn't, say, the main focus of this report? And if it could as well, just again, ballpark, we've already talked about agency workers. Do we retain any or many of them? I know you've already explained how they're taking on specific roles and then those roles might not be around anymore, but again, do we take people on as agency workers, and then if we think they're worth keeping, do we keep them?
Thank you for the question, Councillor. I was just trying to look whether I had included our kind of turnover rate in the report, and I don't think I have, because it wasn't one of the things that kind of came through as a theme. But I do know that we do hold that data, and from memory, and I'm not going to quote any numbers, but from memory, I think we perform quite well in terms of, you might call it a turnover rate or a churn rate. So on the flip side of that, that means our retention rate is strong. But again, I can bring kind of some further data if that's an area that the committee would like to explore in more detail. Can you just remind me of the second part of your question? Yes. So there's 2 points with agency staff. If it's a kind of stopgap type use of agency staff where we're moving to permanent recruitment, so it's filling while we're recruiting, then absolutely, if that agency staff member wanted to kind of move into a permanent role, then they would be eligible to apply for that. So absolutely. And then the other element of that is that wherever we use interims, agency staff, specialist capacity, we are really focused on making sure that there's a transference of skill to our permanent staff members. So part of the brief for those agency staff members is that they are also upskilling and developing our permanent staff. Obviously, some people do agency work because they like to just do those interim and short-term contracts. But there are examples where agency members of staff have been converted into permanent members of staff. Yeah.
Slight detail, but it's linked to that kind of idea of like upskilling and keeping people. Again, apologies if it wasn't kind of the focus of the report, but one thing that I think isn't mentioned is induction. We've talked a lot about obviously exit interviews, but induction, was that something you looked at? Is that something we're confident about and we think contributes to keeping people here?
So induction is a space, so induction and onboarding is a space that we know, again, we want to make some significant improvements. I think that improvement journey has already started, and our employees are reporting a more effective induction process. And again, anecdotally, I met with a cohort of new inductees yesterday, and for the first time, they were all, the first one of those that I've been to, they were all people that had started within the last kind of 2 months. Some of the early ones of those meetings that I was doing when I joined the council, there were people who'd been here for like a year and were only just going on their induction course. So we have already started to make improvements around that, but there's still work to do, and we're kind of collating feedback from new employees about what would have helped, what would have made their onboarding experience better, and kind of building in that into our induction provision. So again, that features in the action plan.
Thank you. Councillor Sue Sands.
Just listening intently. Mine's about well-being measures. Councillor Fulton-Castleton didn't go over this one, so I'm going to have a look. I really enjoyed reading what you're putting in place, but I was wondering if I could focus specifically on the menopause support. In my career, I was told to stop whinging and just get on with it. So it's good to see that this is actually something that's flagged up and is seen as important, as they all are. But I was wondering if it was possible, I'll just get your specs on, to have some expanded information about exactly what the e-learning cafe and book scheme looks like. I'm sure everybody else would be interested in knowing, but I would really like to know, and I'd also like to pinch some of the ideas for some other places that I'm involved with as well. Thank you.
Yeah, so there's a number of things there. The e-learning is our kind of digital platform. So we use a platform called Learning Room, and that has a number of different people-related e-learning modules. So sort of menopause awareness and support is one of those, and that covers both people who are interested for themselves, but also if you're a manager and you're supporting staff members, or if you're a colleague and you want to offer peer-to-peer support. So that covers that. The cafe is a kind of a more informal kind of drop-in session. So, you know, come and share your experiences, your lived experiences with colleagues. And the book scheme, I believe, is a kind of library. So sharing kind of written materials, perhaps books that deal with supporting people through the menopause. What we're really keen to do is that we continue to offer, and I'm going to use this word, I've used it a lot this week, but a pick and mix sort of menu of different support packages, because we really need to realise, you know, we need to be really cognizant that everybody has a different experience and we need a range of different support measures, because one size doesn't fit all, and, you know, making sure that people can self-select the kind of support that suits them the best.
Thank you. Councillor Knight, next, please.
First of all, I want to say that I haven't planned to butter up my colleagues on either side, but I would like to echo the praise on menopause support and on the family-friendly policies mentioned here. In light of the significant mental health and wellbeing impacts of infertility and fertility treatment, is there any support available for employees experiencing infertility or undergoing fertility treatment?
That's a really good point, and thank you for raising it. So as far as I'm aware, we don't have anything specifically for that area. You know, it would fall into our general kind of support packages, and so hopefully people would feel that they were able to have that conversation. But I think that's a really good point that we could take away and look at whether there's something specific we can put in place there.
Thank you. Just so that everyone's aware which hands I've seen at the moment, Davis, Galvin, Mike Sands and Smith and Stutely. I'm conscious that we're probably getting towards the hour mark looking at this item, so I'd like to see if we can get to a point of bringing some of these questions, drawing it to a close fairly soon. But without any further ado, Councillor Davis, please.
Thank you. I'll be quick. So this is about LGR. What's the expected demand for consultants, and what is being done to keep the reliance on consultants in check in terms of budget? And also, our staff must be incredibly worried about LGR and whether they have jobs to go to in the future. How much notice are they going to be given on whether or not they need to apply for their jobs? What support is being put in place, because obviously we will want to retain people. We don't want people to just leave because they're not sure if they've got a job to go to in the future.
Thanks, Councillor Davis. In terms of resource, in terms of demand for consultants, we are just beginning to develop the sort of plan for implementation. We're expecting that ministerial decision following submission in March next year. Of course, we'll be much clearer then about whether, what the kind of future structure for Norfolk looks like, and we'll be able to firmly plan for implementation and recruit and resource in the right way. It's likely to be a mixture of resources. We will want, of course, all of our colleagues who are experts in their field and who have the skills to be involved in the implementation, standing up new councils, dissolving old councils. We want all that to be incorporated into that work. So a mixed picture. We've just started meetings about budget setting, and we raised that point today about we need to be thinking about next year's budget and what needs to be included. So that thinking is all going on. In terms of colleagues, we have had the sessions this week and they've been open. People have been able to ask anything they want, and there's been a message very clear in those meetings that if people don't feel able to ask there, then please reach out to any of us in any form to share any concerns, any worries they might have. I think it's too early to know, what LGR will look like, what the structure will look like. the message that I've been sharing with colleagues is that, you know, the work that everybody does every day still needs to continue. You know, we still need to deliver really good services for all of our residents. However, what will be key is transformation, grasping the opportunities that are there through digitalisation, AI, you know, looking at our delivery models in a way that transforms them, prevention rather than reactive, all of that kind of stuff. But the message is there'll be loads of opportunity from this, and, you know, we're a way away from the kind of vesting day period. So that's the messaging to colleagues. In terms of support, we're clear that we need to get our heads around, you know, a programme of support for colleagues, which is about all of the things we've talked about tonight, about well-being, but about training and development, what opportunities look like, how people might take advantage of those, you know, what training and development people have got, as Emily said, what skills have people got that might play into all of this. So we're just starting that, and that kind of will come forward and be available to share as we develop it. Yeah.
Very quick follow-up. So I heard about Thrive today. Was it called Thrive? Is it a new app? A new wellbeing app? I heard there was a new council wellbeing app. Today. I just wondered if councillors also had access to it. Does it not?
No one knows about it.
Maybe it doesn't exist.
It's reasonable points.
Shall we come back to you on that?
Yeah. Sounds quite exciting. Well, let's carry on. We'll move on to Councillor Galvin.
Thanks. It kind of links to that in a way. If you're asking if councillors have access, I fully accept that the staff and the paid service is separate to the political world, but we're a really interesting organisation because we are run democratically. We're not a business in the sense that, well, we are a business, but we councillors are a big part of what we are as an staff team here. The part of the culture, I think, should be that you're working for a democratic based organisation. So it's a public service organisation. So I'm just interested in how the culture change, kind of what you picked up around that in the culture change work and whether going forward, because I mean, I don't think councillors were really involved in that. And I think as a councillor, you're very aware of the culture within an organisation because you run against it. It's invisible, but it's powerful. And I'd like to sort of formulate some way of having a recommendation to include councillors in that. I accept it was shared with political leaders, but it's interesting for councillors to be involved in that culture change too, and, you know, be part of it. I did see the digi updates and things. I thought that was really good. I watched the one on AI. It was really useful. So yeah, just how do you think that we can reflect the fact that we're a public body in the culture work, and in fact councillors can be involved and cited on all that going forward? Thanks.
So for me, there's a really important point there about how members and officers have a collective responsibility for this organisation and how we can ensure that that working relationship is really effective, is really close, but obviously respecting the boundaries between the member role and the officer role. So we absolutely could share the outcomes of those cultural surveys that we did. So the report talks about the organisational effectiveness inventory and the organisational cultural inventory, which are just kind of two diagnostic tools that we've used. So we could certainly do something like an all-member briefing on what those told us, what that identified as kind of predominant cultural traits of the organisation and areas where we think we could dial that up. And then also we could perhaps look at how we involve members more in that cultural change. I'm really keen that we look at more ways that we offer training for members and officers together. So there are more occasions where we can bring officers and members together in a forum. So there's, you know, there's things, some of the things that we've talked about today about supporting our officers through change are going to be relevant to members who are also going through a change of organisation. So, you know, I think there's lots of opportunity there. And I think, Councillor Galvin, you talked about the tip of the iceberg earlier, and I think that's exactly what this is. And I think there's lots that we can do.
Thank you. Councillor Mike Sands, next, please.
Thank you, Chair. I'm just putting on my Armed Forces hat here. What support is given to new employees who may be ex-forces? And also, moving on from there, what provision is made for employees who may be current reservists and who may be called upon for annual training of 2 weeks or even deployment? And do we currently have anyone?
So, Chair, Councillor, I'm afraid I'm going to give a fairly wishy-washy answer to this because I'm afraid to say I don't know the detail behind it. What I can tell you is that we are members of the Armed Forces Covenant, so we have arrangements in place to support veterans with applying for jobs and also those people who are reservists or who have responsibility. So I'm sorry, I don't know the detail of what that looks like in practical terms. I can take that away and get you some information about that.
It would be worth it, because if we have any current reservists and we are supporting them in the various ways that the Covenant calls for, then we're on the way to achieving the Gold Award for the Armed Forces Covenant as well.
Thank you. Councillor Smith, next, please.
No, it's a question from me. It's already been previously answered. Okay. Sorry.
Great. Thank you. Councillor Stootley.
Thank you, Chair. Thank you for the report. You covered some questions on interims and agency staff, and it's clear the council has a desire to reduce the numbers for several good reasons, including costs. And you also said the councils calculate those costs using different methods. But I've had a quick look, and it appears by any measure our outlay on agency staff and interims is much higher than comparable councils. You can disagree with that if you've got the data, but it looks like we're on the high side of any measure. So I'd like to see some data that breaks down the levels at which people are appointed within the organisation, so senior level or lower levels, because that could indicate where we may be an outlier. So I'm going to have some recommendations for strengthening the governance of interim appointments, especially at those senior levels, if I may. And on a related matter, does the council have a policy for the governance of interim appointments to council-owned companies and joint ventures, please?
So in response to the direct question about council-owned companies, the company board would be responsible for that company's recruitment policies. So as shareholder, we wouldn't necessarily have a direct influence over that. However, we would have an assurance role. So there is no council policy about appointment of interims to council-owned companies, because the appointment other than board members predominantly lies within the company itself.
Thank you for that. Councillor Knight, please.
You can tell that I'm new to Scrutiny because once again I'm starting with a little bit of praise. As a young queer person, I think it's absolutely amazing on page 17, 3.8, that the staff networks and Pride Network, Younger Colleagues Network is taking place. I think that's absolutely amazing. But I'm just wondering what support is being provided for members of racialised minorities to create a network of their own.
So what we're trying to do with the staff networks is encourage them to be developed by the staff. So it's not a leadership-led initiative, and it's not a management, you must form a staff network. So we're trying to create the conditions where members of our workforce who share characteristics or share a common interest can form those networks in a supported way. So there's some kind of practical things that we do to make that easier, so providing space for them to meet. There's an element of the learning and development budget that has been allocated to supporting our staff networks. But we really hope that they'll be kind of driven by the workforce and kind of grow organically, if you like, rather than us kind of intervening in those.
Yeah, that sounds like a really positive project. Thank you.
Thank you very much. I'm now going to draw a line under questions. Now, a number of people have used the R word in their speaking, recommendations. I wonder if we can have those, anyone who does have any recommendations, to get some hands up, and we'll get some formal wording that we can then ask Alex to note down and then have a vote on as appropriate. So Councillor Davis, and then Councillor Galvin and Councillor Kane.
Could I make a recommendation that we do a mental health survey, a staff mental health survey, so that will give us more idea about the mental health sick days and whether those people are feeling supported and whether they're staying in the roles or whether they're feeling they need to leave the roles. Thank you.
Thank you. Councillor Galvin.
Could we have the action plan to scrutiny relatively soon, I guess, if we can fit it in, and perhaps have it with the recommendation alongside that we perhaps can look at other areas if we, to actively look at the action plan. And then also about the culture change piece, if we can see, you mentioned having a briefing on that, but yeah, if we can see the reports and have an all-staff briefing would be useful. And I'm not sure how you'd want to frame that, but I'd really like to see that work done to enable councillors to be trained to have some officer and councillor joint training. Also a councillor induction programme. We don't want to make this all about councillors, but at all, because it's staff, but it is quite important that councillors get a good induction, which involves a lot of staff ideally, and a proper tour around what we do. And I think if we could have that scoped and have some input into the scope of that, would be really helpful. Thank you.
The only thing I will say on that is, for the purposes of this council, I wonder how many more councillors are actually going to be inducted.
Come back on that and say, could we do it for everyone anyway, just like all councillors? Because honestly, I got re-elected a few years back, and I'd been elected the first time I was elected, in 2011. I got an induction. This time I've never had one, and I think we might as well all get an induction. What do you think? I take your point. There probably won't be many new councillors.
Yeah, valid point. Councillor Kane, I think you'd indicate.
I was actually going to recommend the same thing that Councillor Davis did, but also forgive my slight ignorance on this. I also spoke about the equalities stuff at the beginning. So if this isn't something that isn't going to be covered in the equalities report, having a separate report on diversity and the steps taken to improve representation of diversity within the staff.
Councillor Knight.
I would like to make the recommendation that there is a specific, or the development of a specific wellbeing policy for fertility and infertility. Thank you.
Councillor Mike Sands.
Thank you, Chair. I'm certain we already do, but I'd like to make a recommendation that we have an officer who is a Armed Forces Covenant liaison, and also perhaps a survey of anyone who is a current reservist or contemplating joining the reserve forces.
Sorry, I'm just trying to get my head around your certainty that we already do it, but we're making it as a recommendation. But I get the point. Yeah. Councillor Fulton McAllister.
Thank you, Chair. I know it's would still like to have it as a formal recommendation that we look at supporting a temporary increase in facility time for trade union colleagues. If nothing else, the reason being that I spend a lot of my time negotiating with pretty awful Tory counties, and the small glimmers of hope I get as a trade union official when I do see these things as formal recommendations is really positive. So I want to give my counterparts that same small bit of joy.
Councillor Stuteley.
Thank you. I'd like to recommend that the council strengthens its policy and introduces a monitoring framework to limit the use and duration of interim and agency staff, ensuring a transparency and timely transition to permanent appointments. And I've written some up, but they're quite long, so I don't think we've probably got time to go through them. So what's the procedure for that? Should I forward my suggestions to officers, or is it something that we'd like to go through here?
I'm not sure that we're perhaps best placed to sort of go through them this evening. We're just trying to work out, I'm looking at you, Emily, in terms of, because we can agree in principle that process, and it's where the detail then sits before it arrives at Cabinet.
So, Chair, if you want to confirm them as formal recommendations of this committee, you need to go through the detail so you can vote on them. If it's something that Councillor Stuteley would like to talk to us outside of the meeting so we can refine that and bring it back, we can do that, but obviously it won't form part of this tranche of recommendations that you're now going to go through. So I suppose it depends on whether it needs to be a formal recommendation to Cabinet or to the head of paid service, or whether it's something you'd like to discuss with the head of paid service and then decide whether a formal recommendation is needed.
Yeah. I guess I'm just thinking that different of us have different learning styles, and if it is detailed, I'm not necessarily sure that as you're reading it, Alex will be able to capture it correctly. And we did have a period in the committee where we would put the recommendations on the screen for those of us that find it easier to read something rather than actually taking all the detail when listening to it. So yeah, I mean, if they need to be part of the formal recommendation, then please go through and read them out, and Alex will no doubt do the best to sort of get those down, and members will do their best to understand the detail.